Have you ever felt unusually tired for no reason? Not the kind of tired you get after a long day or a bad night's sleep, but a deep, strange fatigue that just won't go away. Maybe you brushed it off, told yourself it was just age or stress, or maybe the weather. But what if I told you that feeling could be your heart's silent cry for help? Heart attacks rarely look like what you see in movies. They don't always come with someone clutching their chest and collapsing dramatically. In real life, especially for people over 60, heart attacks often whisper before they scream. The signs are subtle. So subtle, in fact, that most people ignore them until it's too late. Every year, thousands of older adults in the U.S. suffer heart attacks that could have been prevented if only they had recognized the early signs. These warning signs don't always scream emergency. Instead, they creep in quietly. A little shortness of breath here, a bit of pressure in the chest there, some lightheadedness you chalk up to standing too fast. But when your heart is in trouble, these little things matter. Here's the terrifying truth. By the time many people realize they're having a heart attack, permanent damage is already being done. And in some cases, the first sign of heart disease is sudden death. I know that sounds harsh, but ignoring the early signs of heart trouble is like ignoring smoke in your kitchen, thinking it'll go away on its own until your whole house is on fire. That's how fast things can spiral when it comes to your heart. In today's video, we're diving deep into 6 early warning signs of a heart attack that older adults often overlook. These are not the textbook symptoms. These are the tricky ones, the ones that sneak past your radar because they don't feel like a heart problem at all. If you're over 60 or you care about someone who is, what I'm about to share could literally save a life. We're not just talking about living longer. We're talking about living better, with a heart that's not quietly struggling to keep up. So stay with me. Don't scroll away. Because if you recognize even one of these signs in yourself or a loved one, you'll want to act before it's too late. 1. Unusual fatigue, when tiredness is a silent alarm from your heart. Have you ever woken up in the morning feeling like you hadn't slept at all? You went to bed early, got your full 8 hours, didn't do anything strenuous the day before, and yet your body feels heavy, your steps slow, and every little task in front of you seems unusually hard. You sit for a while, hoping a cup of coffee will shake the feeling off, but it doesn't. Even small routines like brushing your hair or walking to the mailbox feel like too much effort. If this sounds familiar, and especially if it's happening more often as you get older, it's time to stop and listen to what your body is trying to say. This kind of deep, unexplained fatigue isn't just normal aging. It could be one of the earliest and most ignored signs that your heart is in trouble. While many people think a heart attack begins with dramatic chest pain, the reality is much quieter for most, especially for older adults. The heart, when under stress, can't pump blood as efficiently, and when your organs and muscles don't get the oxygen they need, your whole system slows down. That slowdown doesn't always come with warning sirens. Sometimes, it shows up as the simplest feeling. I just don't have any energy. You might not even think to connect it to your heart. Maybe you'll blame poor sleep, stress, or low iron. Maybe you'll convince yourself it's just a phase. But this type of fatigue tends to linger. It doesn't go away with a nap or a day off. It becomes part of your new normal until one day it isn't, because something worse has happened. What's dangerous about this symptom is how easy it is to dismiss. Our culture often tells older adults that getting tired is just part of the process of aging, and while some decline in energy is natural, this kind of exhaustion is not. It's not just being tired after a walk, it's struggling to make the bed, to shower, to even carry on a conversation without feeling worn out. For some, this fatigue is physical. For others, it's mental or emotional, a kind of cloud that dulls your motivation and your interest in things you used to love. It can slowly pull you out of your daily life, one skipped activity at a time. And sadly, it often goes unnoticed until something forces urgent medical attention. Studies have shown that unusual fatigue can appear days or even weeks before a major cardiac event, particularly in women. This makes it not only a symptom, but a powerful early warning, one that could make all the difference if caught in time. If you've been feeling this kind of fatigue lately, don't brush it off. Track it. Reflect on when it began. Notice if it's getting worse, or if it's paired with other subtle changes like shortness of breath, dizziness, or poor sleep. Don't wait for something dramatic to happen. The earlier you act, the more you protect your heart. In a world where heart disease remains the #1 cause of death, recognizing the quiet signs can be a life-saving skill. So the next time you feel that strange, lingering tiredness that doesn't make sense, stop. Take it seriously. Your heart might be trying to tell you something. And if you listen early enough, you just might give it the help it needs before it's too late. to pain or heaviness in the chest area, but not clear. Sometimes the most dangerous warning signs don't feel dangerous at all. Imagine this. You're sitting quietly reading a book or watching television, and you notice a strange sensation in your chest. It's not sharp. It's not even what you'd call painful. It's more like a weight pressing down, a tightness, or a mild discomfort that you can't quite explain. It comes and goes, maybe lasting only a few minutes, so you brush it off. You tell yourself it's indigestion, maybe gas, or just anxiety. You go back to what you were doing and forget about it, until it happens again and again. What many people don't realize is that this kind of vague, nonspecific chest discomfort is one of the most common early signs of a heart problem, especially in older adults. We've been conditioned by movies and television to expect heart attacks to be sudden, dramatic events, clutching the chest, falling to the floor. But in reality, for many people over the age of 60, heart issues begin quietly, with a sensation that feels more like pressure than pain. It might feel like someone is sitting on your chest, or like you're wearing a tight band around your ribcage. Some describe it as a dull ache, a fullness, or even a burning feeling. It can be in the center of the chest, off to one side, or sometimes it even radiates to the back, jaw, or shoulder. The tricky part is that this kind of chest discomfort is easy to mistake for something else: heartburn, muscle strain, or stress. And because it doesn't scream for attention, it often goes unreported. But your heart is a muscle that works nonstop, day and night, to keep you alive. When it starts to struggle, one of the first places you'll feel it is in your chest. That sensation, even when it's mild or irregular, is your body waving a red flag. Unfortunately, many older adults ignore this sign because it doesn't fit the dramatic stereotype of a heart attack. They wait for something more obvious, more painful, more undeniable. But by the time that moment comes, the damage could already be done. In fact, some people who suffer major cardiac events later recall having experienced these subtle chest sensations days or even weeks beforehand, moments they didn't think were serious enough to mention to anyone. Some didn't want to seem like they were overreacting. Others simply didn't know that this dull tightness could mean something life-threatening. And here's something even more important. Not everyone experiences chest discomfort the same way. For women, older adults, and people with diabetes, the sensation may be even more subtle or unusual. That's why it's so important to know your own body and to recognize when something just doesn't feel right. If you begin to notice a recurring heaviness in your chest, especially if it happens with mild exertion or stress and goes away with rest, it could be a sign of angina, a warning that your heart isn't getting enough oxygen. Left unchecked, this can lead to a full-blown heart attack. Don't wait. If something in your chest feels off, speak up. Don't downplay it, don't delay, and don't diagnose yourself. Get it checked. It's always better to be told it's nothing than to find out too late that it was everything. 3. Unusual shortness of breath, even without strenuous activity. You're not climbing a mountain. You're not running a race. Maybe you're just walking to the kitchen, making your bed, or talking on the phone, and yet, suddenly, you feel short of breath. Not panting, not gasping, but just a little winded in a way that doesn't make sense. You pause. You sit down. You tell yourself it's probably nothing. Maybe it's the weather. Maybe you're just out of shape. Maybe it's your age catching up to you. But deep down, something doesn't feel right. This isn't normal. And here's the truth. That kind of unexplained shortness of breath is often an early and serious warning sign that your heart is struggling to do its job. Your heart and lungs work together as a team. When the heart is healthy, it pumps blood effectively through your lungs, picking up oxygen and sending it out to the rest of your body. But when your heart begins to weaken, whether from blocked arteries, damaged valves, or hidden heart disease, it can't keep up with the demand. Your lungs start to compensate, and that's when you feel it, that quiet but persistent feeling of being slightly out of breath. The cruel thing is, it doesn't always come on strong. It can be subtle, sneaky. You may not even notice it at first. Maybe you find yourself breathing just a bit harder than usual when walking up a short flight of stairs. Maybe you're lying in bed at night and suddenly have to sit up just to catch your breath. Or maybe you notice that talking for a long time makes you feel oddly winded. And while it's easy to blame things like aging, allergies, or even anxiety, persistent or recurring shortness of breath, especially when there's no clear reason for it, is never something to ignore. What makes this symptom so dangerous is that it often feels mild, even tolerable. Many people adapt to it slowly, adjusting their lifestyle without even realizing it. They stop going on walks, avoid physical activity, or spend more time resting, thinking they're just slowing down with age. But in reality, they're compensating for a heart that's no longer working at full strength. In some cases, the breathlessness comes with other clues: a slight tightness in the chest, a fluttering heartbeat, or even light swelling in the ankles. But even on its own, unusual shortness of breath is a red flag that something deeper is happening beneath the surface. And here's something especially important. For many people, this symptom appears before any chest pain or obvious sign of a heart attack. It's often reported by patients who later discover they had heart failure, valve disease, or coronary artery disease that had been quietly progressing for years. If you find yourself frequently short of breath during everyday tasks, or worse, if you're waking up in the night gasping for air, don't wait. Don't assume. Don't hope it will just go away. Talk to your doctor, ask for a heart checkup, and trust your instincts. Your body is trying to get your attention, and every breath matters. In many cases, early detection and treatment can prevent serious complications or even save your life. Because shortness of breath, when your life is otherwise still and quiet, might be the loudest warning your heart ever gives. Sign 4: nausea, indigestion, or strange stomach pain. You eat a simple meal, nothing too spicy, nothing heavy, and yet, not long after, you feel an uncomfortable sensation rising in your stomach. Maybe it's nausea. Maybe it's a strange tightness in your upper belly. Perhaps it feels like indigestion or a mild cramping that won't quite go away. You take an antacid. You sip some ginger tea. You wait. But the discomfort lingers. It's not severe, but it's just not right. It's easy to assume it's your stomach acting up. Maybe something you ate. Maybe just your age. But here's the part most people don't realize. Sometimes, when your heart is in trouble, it doesn't announce itself with chest pain. Sometimes, it whispers through your gut. Nausea, indigestion, and abdominal discomfort are surprisingly common early warning signs of heart problems, especially in older adults and especially in women. When the heart is under stress or not getting enough oxygen, it can trigger a chain of signals throughout the nervous system. The vagus nerve, which connects your brain to your heart, lungs, and digestive system, can become irritated. The result? You may feel sick to your stomach, even if there's nothing wrong with your stomach at all. That's why these symptoms are so easily overlooked. Most people don't associate a little nausea or belly pressure with their heart. They think it's food poisoning, a minor bug, or just stress. But what makes this symptom dangerous is its subtlety. It doesn't always come with other obvious signs like chest pain or shortness of breath. Sometimes, abdominal discomfort is the only symptom, especially in women who experience heart attacks very differently from men. In some cases, the discomfort might feel like gas or bloating. In others, it's a dull ache right below the ribs or even a burning sensation mistaken for acid reflux. You might feel full even after eating very little or have a sudden loss of appetite. Some people experience actual vomiting before a heart event. It can feel so much like a gastrointestinal issue that people waste precious hours or days treating the wrong problem while their heart is silently struggling. And it doesn't just happen after eating. Some report that the discomfort comes on randomly, even while resting. Others notice it during mild activity, bending over, walking short distances, or doing household chores. They may feel flushed, sweaty, or dizzy at the same time, but often dismiss it as something they ate or the flu coming on. In reality, the body is waving a flag, not from the stomach, but from the heart. This is why it's so important to pay attention to unfamiliar patterns in how your body feels, especially if you're over the age of 60 or have risk factors for heart disease like high blood pressure, diabetes, or a history of smoking. If you begin experiencing recurring indigestion or unexplained nausea, particularly when paired with fatigue, lightheadedness, or any kind of chest or jaw discomfort, don't ignore it. Don't just reach for the antacids. Get checked. Even if it turns out to be nothing serious, ruling out a heart problem is always worth it. When it comes to your heart, subtle symptoms are not safe symptoms. The body has a way of sending signals, even when they're quiet or confusing. A strange sensation in your stomach might not be about your digestion at all. It might be your heart asking for help before it's too late. Sign 5. Cold sweats, dizziness, lightheadedness, for no apparent reason. Have you ever suddenly felt like you're about to faint? Maybe you're sitting comfortably, enjoying a quiet moment, when suddenly you break out in a cold sweat. You feel dizzy, lightheaded, and your world seems to tilt for just a moment. You blink, shake your head, hoping the feeling will pass. You breathe slowly, telling yourself it's probably nothing. Maybe you've been sitting too long. Maybe you stood up too quickly. But what if it's more than just a momentary lapse? What if your body is trying to send a message you can't afford to ignore? Sweating unexpectedly, especially cold sweats, is often a sign that your body is under stress. And when that stress is coming from your heart, it's not something you can just brush off. Many people, particularly older adults, don't recognize that this sudden dizziness and cold perspiration are linked to heart problems. They might mistake it for a simple drop in blood pressure or think it's just dehydration. But when these episodes happen without any clear reason, and especially when they come with feelings of weakness or faintness, it's time to start paying closer attention. The body is a complex system, and the heart plays a vital role in regulating everything from your blood pressure to your temperature. When your heart isn't functioning properly, whether from a heart attack, arrhythmia, or another issue, it can disrupt the normal flow of blood and oxygen throughout your body. This causes your body to respond in strange ways. That cold sweat, the sudden dizziness, the sense that your legs might give way, these are all signs that your heart isn't keeping up with the demands of your body. The body is trying to get you to stop, to rest, to take notice. What makes this symptom so tricky is that it often doesn't come with the dramatic chest pain or crushing pressure that many expect. Instead, it's subtle. It's a slight wave of dizziness or lightheadedness that hits you out of nowhere. Sometimes it passes quickly, but sometimes it lingers, making you feel weak and unsteady. Your palms might become clammy, and you might even feel a sudden sense of nausea or confusion. If this happens frequently, or if it happens in combination with other symptoms like chest discomfort, shortness of breath, or unexplained fatigue, it's crucial to take action. You see, the sudden drop in blood pressure or the interruption in blood flow to the brain can be an indication that your heart is struggling to do its job. Whether it's from an arrhythmia, blocked arteries, or any other form of heart disease, this lack of adequate blood flow can result in fainting spells or a feeling that you're on the brink of losing consciousness. If you've ever experienced this, you know how alarming it can be, and if it's happening regularly, it could be a sign of a more serious underlying issue. Even if you're not experiencing the intense chest pain associated with a heart attack, don't let this sign go unnoticed. If you find yourself sweating for no clear reason, feeling faint or dizzy without cause, or just generally feeling out of sorts, it's important to consult with a healthcare provider. These might be small warning signals that are often easy to overlook or dismiss. But just like with any other heart-related symptom, early intervention can make a life-saving difference. Your heart doesn't always send out loud, obvious alarms. Sometimes, it whispers through cold sweats, dizziness, and faintness. Don't wait for the loud siren. Listen to the quiet warnings now, while they're still easy to manage. Your body is trying to protect you, but it needs you to act. Sign 6, radiating pain, in the neck, jaw, shoulders, or back. You've probably heard the common warning signs of a heart attack: the sharp, stabbing pain in the chest, the feeling of tightness or pressure. But what if the pain doesn't come in the chest at all? What if it starts somewhere else, somewhere unexpected? One of the most dangerous and frequently overlooked signs of a heart problem is when pain or discomfort radiates away from the chest, often affecting the neck, jaw, shoulders, or back. And when you're older, this symptom can be even harder to recognize. Imagine sitting at home, relaxing, when you suddenly feel a sharp pain or discomfort in your neck. Or maybe it's in your jaw or your left shoulder, and it feels strangely like a tension headache or just a muscle strain. You may try to stretch it out, massage the area, or change positions. Perhaps it goes away for a while, but then it comes back again, off and on. It's easy to think it's just a pulled muscle or poor posture. After all, you've had tension headaches or stiff shoulders before, right? But if you experience this kind of pain along with any other unexplained symptoms, don't brush it off. It could be a signal that your heart is in trouble. When the heart is deprived of oxygen, due to blocked arteries, a blood clot, or other forms of heart disease, the pain often doesn't stay confined to the chest. The heart is in the center of your chest, but the nerves that surround it send pain signals to other parts of the body. This phenomenon is known as referred pain, and it can happen in the neck, jaw, shoulders, arms, and even the back. It's one of the body's ways of letting you know that something is wrong, but it can be incredibly misleading. Because this pain doesn't come with the typical chest discomfort most people expect, it's easy to dismiss it as something minor. But the reality is, pain in these areas, especially if it's sudden, persistent, or unexplained, can be a clear sign that your heart isn't functioning properly. Many people, particularly older adults, don't recognize this pattern of referred pain. They might think it's just the result of muscle fatigue, aging, or stress. However, when the pain starts to spread or intensify, it's a clue that the heart is struggling. You might feel pain that radiates down your left arm, travels up into your jaw, or spreads to your upper back or between your shoulder blades. It might feel like a dull ache, a sharp stab, or even a burning sensation. And sometimes, it's accompanied by other symptoms like shortness of breath, nausea, or dizziness, which should never be ignored. If you're experiencing pain in these areas, especially if it seems out of the ordinary for you, don't wait for the pain to worsen or for the chest pain to calm. Pay attention to the clues your body is giving you. If the pain is persistent or increases over time, or if it's linked to physical exertion, emotional stress, or any other trigger, it's time to seek medical attention. The earlier a heart problem is detected, the better the chances of successful treatment. What's particularly dangerous about this type of referred pain is that it often presents itself in a way that doesn't seem urgent. The pain may feel uncomfortable, but it's not necessarily excruciating. You might be tempted to wait it out, thinking it will pass. But heart disease doesn't always announce itself with intense pain. Sometimes, it's the subtle symptoms, the kind you might try to ignore or explain away, that are the most serious. So if you're feeling pain in areas like your neck, jaw, back, or shoulders, and it doesn't have a clear cause, it's important to get checked out. This could be your body's way of telling you that a heart attack is on the horizon, and catching it early could save your life. Now that you've learned about some of the early warning signs that might indicate your heart is in trouble, it's important to remember this. Your heart is always trying to tell you something. Whether it's a subtle pain in your chest, a feeling of discomfort radiating through your body, or an unexplained sense of dizziness, don't ignore it. These signs may seem minor at first, but they could be your body's way of giving you the warning you need before things get worse. And the earlier you act, the better your chances are of preventing a major heart event. If you're experiencing any of the symptoms we've discussed, whether it's unexplained chest pain, discomfort in the neck, shoulders, or back, difficulty breathing, or sudden dizziness, it's time to take action. Don't brush it off. Don't wait to see if it gets worse. Schedule a visit with your doctor right away. The quicker you seek medical attention, the sooner your healthcare provider can help diagnose the problem and guide you toward the appropriate treatment. Even if it turns out to be nothing serious, it's always better to be safe than sorry. Your health is too important to leave to chance. Heart disease is one of the leading causes of death, but it's also one of the most preventable. By being aware of the early signs and listening to your body, you're already taking an important step toward better heart health. Whether it's making changes to your diet, getting more exercise, managing stress, or simply paying attention to the signals your body is sending you, every little bit counts. So, if you notice any of these signs, or if you have concerns about your heart health, don't wait. Early detection can save your life. Share this information with your loved ones, friends, and family, because heart health is something we all need to be vigilant about. You never know when one small change, one decision to seek help, might make all the difference. And remember, you're not alone. Whether it's a loved one, a doctor, or even a heart health community, there are people out there ready to support you in your journey to better heart health. Take charge of your health today, before it's too late. Thank you for watching, and don't forget to subscribe to our channel for more important health tips and updates. Stay healthy, stay informed, and take care of your heart.